Hi, welcome everyone. You're here with Blue Cross and Blue Shield of Louisiana. This is our special annual enrollment edition of Medicare Made Easy. I'm Tress Faraday. I'm on the Medicare sales team, and I'm here with my colleague here, Will Phelps. If you have any questions during our session, go into the chat, drop them in. We'll do our best to answer them. This is an ongoing series. We know you have a lot of questions about Medicare. So let me have Will introduce himself, and we're going to get right into it. Will.
Hi, my name is Will Phelps, and I am a benefit specialist for Blue Cross and Blue Shield of Louisiana. And today we're going to cover some things that have to do with annual enrollment. So please, if you have any questions, don't hesitate to drop them in the chat while we're going live today. The first question that we tend to get most of the time around this year is about what is annual enrollment? Annual enrollment is one of everybody who is a Medicare beneficiary's favorite time. This is the time where they can make changes, stay where they are, or even go back to original Medicare. The annual enrollment starts from October 15th through December 7th. And from that time, all benefits that you enroll in during open enrollment will take place on and go in effective for January 1st. Now, the big thing that we have to cover today is with Tress, a lot of the plan value and a lot of different things with all the plans. Can you provide our viewers with any tips and things to look out for while they're making their plan decisions?
Yeah, so it's a lot of information. There's a lot of info about Medicare out there, and it can get very confusing. What we recommend for folks, we call it the 3 Ps, because with the 3 Ps, it can help you kind of organize your information and organize what plans are the best fit for you. So the first P is providers. So that's doctors. So make a list of the doctors you see regularly, the hospitals you want to visit, any specialists that you'd like to see, because you need to make sure you choose a plan that allows you to see your doctors. Also, the question is, can you get your care close to home? Or, so maybe a more narrow network, or do you need nationwide coverage? So those are things that you want to get organized. So when you talk to your Medicare specialist, you can kind of share that with them. The second P is pharmacies, prescription drugs. So making a list of the ongoing covered drugs that you take. You may have ongoing prescriptions your doctor gave you to keep you well. You want to make sure you don't lapse in that. So then you want to plan that these drugs are covered. You know what any copay share will be. You want to know what the options are. Also, just to make it easy to get your prescriptions, because maybe there's a mail order option, maybe there's a 90-day fill, just things to help you make sure you're going to keep your drugs going. Then the third one is plan value. And so everyone right now wants to save a little money, wants to get a few little extras. So do you want to talk to us more about plan value?
Sure. Plan value is what I call the quality of life part of the plan. Medicare Advantage plans are designed to provide quality of life. A lot of times when you are of Medicare age, the one thing that does change, you do get older, but your income doesn't go up. So you're always looking for more value out of your insurance. So what we provide here, and just in general, you're going to have things like a flex card, which will allow you to go to your local retailer, swipe it for things like your over-the-counter pain reliever, things like that. You're also going to get gym memberships. There's nothing better than going and working out and getting a good sweat on and keeping yourself healthy. You also have the wellness built into that. So you have that. You can go to your doctor anytime you want to. And then there's also telehealth. Sometimes there's food cards, things like that. Everything with plan value is all designed to enhance your quality of life in retirement and while you're on Medicare Advantage.
Right. So definitely kind of looking at the 3 Ps, writing those notes down, and then kind of start doing your research, talk to some folks, getting your questions answered. I'm just here to tell you, don't go it alone. It's a lot of information. Our Medicare benefit specialists do annual certification training. You're not born just understanding Medicare. So the fact that these folks are there, they're a resource. There's no cost or obligation to call them, to talk to them and help them as you're getting organized and deciding what's the best fit for you. So just remember that you don't have to go it alone. So we do have some others. So Will is one of our Medicare benefit specialists. We have some others, and we were going to talk a little bit about them, because if you give us a ring on our toll-free number, you may get in touch with some of these folks.
So we want to put faces behind the voices on the phone. So right now we have Ann Booth, who's very, very amazing at what she does. Another one of my favorite people, Khalid Crumpton. Love talking to him. So will you. Hope is great as well. Love talking to her. And for our Spanish speaking people, This is one of our Spanish speaking reps, Kathy Klinger, very knowledgeable, very great as well. Of course, that's me. Love to look at myself. And then we have Ricardo Vega, another one of our Spanish speaking reps. So if you have any questions you'd like to speak in your native language, Ricardo and Kathy are more than able to help you and assist you with that.
So yeah, definitely give them a ring. They're there to help you out. They're there to answer questions, and hopefully make it real clear on your timing and next steps when it's time to make your decision. So there are parts of Medicare. We talk a little bit about that: Part A, Part B, Part C, Part D. It can get confusing of which part is which and which one I need to worry about. Part A, most folks, they've worked their 10 years, they've got their 40 quarters, so there isn't a deductible for Part A. Part B, many folks have a deductible for that, so they may be looking for a Part B give back to help offset some of those charges. Part C is what we call Medicare Advantage, and Part D is prescription drug. And then also something you may hear about is Medicare Supplement. So these are different options kind of in Medicare. So talking to your specialist, understanding that more. Now, a question we always get, there's folks who turn 65, they're ready to enroll in Medicare, they're ready to make decisions, and there's some folks who decide to keep working.
Mm-hmm.
And so I guess talk to us more, Will, about what credible coverage means, how to avoid a late enrollment penalty, like talk us through, because timing matters on Medicare a lot.
Very much so. So when you turn 65, the first thing you're going to see is that the mail that you're getting is going to increase 3 times from what it was before. And a lot of that mail, I mean, it's very, very jumbled, and kind of what you want to do is throw it away, but don't do that. Because when you turn 65, there's a lot of things that you're looking forward to. You're looking forward to retirement, looking forward to hanging out with your grandkids. And the one thing you kind of put to the back burner is your insurance. And I can't tell you how many times that I've talked to people, and the one thing they never realize is they have to have credible drug coverage. Now, if you're still working and you want to work for a while, that's perfectly fine. Because as long as your current employer coverage has credible drug coverage, you're going to be Medicare compliant. The problem comes when you don't, when you decide to get on Medicare, but you don't get credible coverage. When that happens, you're going to get what's called a late enrollment penalty. And when you get a late enrollment penalty, not only does that follow you the rest of your life, it's going to be assessed for every month that you don't have credible coverage. So the longer you go, I mean, we understand being healthy is great and you don't take a lot of medicine, which is why a lot of people stress Medicare Advantage, because you can get these plans at no cost. So you're actually meeting your Medicare guidelines and you're not having to pay for it. So you don't take medicine and you don't pay anything. Can't beat that. But when you turn 65, you want to contact somebody, preferably a Medicare specialist, to kind of go over your options with you, whether it be, going with Medicare Advantage, whether it be going with Medicare supplements, things like that, and making sure you have credible coverage at the end of the day, because you don't want to have to get a late enrollment penalty, especially if it could have been avoided. And I always stress education is key, because when you turn 65, you're going to go into what's called your initial enrollment period, which is the 7 months when you're able to enroll in Medicare for the first time. You get 3 months prior to your 65th birthday, the month of your 65th birthday, and then 3 months after. So in that time frame, you need to go ahead and, at least if nothing else, apply for Medicare Part A, which is going to be given to you for the amount of time that you work. You're going to see it on your check. Every time you're paying a Medicare tax, once you worked your 40 years or paid your 40 quarters, you're going to be able to qualify for Medicare Part A. That's going to be gifted to you. Medicare Part B is going to be what you're paying $170 for. Now, in order to get on a Medicare Advantage plan, you have to have the Part B. So that's going to run you about $170 or $160. It just depends on the year and the price at the present time. And then from there, you got to get a Part D plan or go with Medicare Advantage where you have it built in. And then from there, you're good to go.
So what if, Will, there's folks who, okay, this is, there's a lot of words here.
Mm-hmm.
There's original Medicare, there's Medicare Supplement, there's Medicare Advantage. Like, how do they navigate these options?
At the end of the day, you have to do what's best for you. That's how you navigate those options. Medicare supplements, I mean, they have their genre. I mean, Medicare Advantage has its arena, because one, a lot of people who are going to go with Medicare Advantage are going to be looking for, what can my insurance plan do for me at the end of the day? So that's going to be where they go. A lot of people who go Medicare supplement just want to go to the doctor, pay their money, and go home. So it just depends on what fits you. And the best way to do that is talk to somebody who's knowledgeable about it and experienced with that, and they'll guide you through that process.
Right. So having the questions, kind of getting organized, getting your information organized, making sure you're getting the care you need for your specific situation. Some folks, when they're younger, they're not taking a lot of drugs, they're not seeing a lot of doctors, but as they get older, that changes. So also, is the plan going to change as your needs change? Some folks stay in one location, so I'm getting my care close to home. Some folks are splitting their time. They're going to visit grandkids. They're going other places. So these are topics and these are questions that you need to go through with your benefit specialist, because it'll help them guide you to get you in a plan that's a good fit. Because ultimately you want to stay healthy, you want to stay well, you want to travel, you want to have fun. You don't want to sit around and, and feeling ill and not getting the care you need.
But the big thing when you're selecting a plan, I can't stress this enough, your medicines and your doctors, because it doesn't matter how much extra benefits you have on the plan. If you can't go see your doctor, basically you can't do anything with your insurance. So always make sure you have them. I mean, when you're going through this, check your doctors, make sure your doctors are in the plans network, and make sure you can get the medicine at the price you want to get it at. Those are two of the biggest things that matter.
Right, definitely. Just making sure you're getting the doctors and the meds, and just making a plan. I'm a bit of a planner, hopefully some other folks on here. So kind of taking some notes, and also the timing. We talked about the timing. You don't want to wait to the last minute and then you don't have time to really make your decision. Talk to family and friends who've done it, kind of gotten there before you. If you're going to continue to work and staying on your employer coverage, talk to the benefits, person there, because you're probably not the first employee who's kind of gone through this and stayed working. So just kind of make sure, you're going to all your resources, taking your notes. So when you can choose the timing of when, okay, now's time. Now I'm gonna make a decision. I've already done my research. So that's a great opportunity. So I do want to talk about, because right now it is October. I want to talk about flu season. So it is flu season, and the CDC recommends that we get our flu shot before the end of October. So if you haven't gotten your flu shot, please remember to do that. Now, folks 65 and older can have kind of higher risk and higher complications from the flu. I know sometimes we think it's just the flu, no big deal, but for some folks, it can be serious and have complications. The CDC has newly recommended a higher dosage for those who are 65 and older. So you probably want to talk to your doctor or talk to your pharmacist about this, but now is a great time to talk about flu shots. Remember to get your flu shot. The CDC recommends those who are 6 months and older get a flu shot. So it is recommended the majority of us get it. And so we want to recommend that. And so we do have a video from one of our medical directors that will tell us a little bit more about the importance of flu shots.
Hi, I'm Dr. Emily Vincent, a physician at Blue Cross, here with a health note. In preparation for flu season, you really need to start watching for those flu vaccinations to roll out and consider getting them when they do, so that you're vaccinated before peak flu season hits.
All right, so yes, so that is your reminder, flu shot, flu shot, flu shot, please don't forget. So we're here. If there are any questions in the chat, drop them in. We're here to answer your questions. What are some of the, any other questions that you get? I know you mentioned the late enrollment penalty, how to avoid that. What are some of the common questions you get, Will?
The biggest question we get is always, how big is your network? Because, we do have a PPO versus a TUM versus our HMO situation. So that's always our big thing is, how big is your network? And can I go see my doctors on my terms? That's also a question. I do see a lot is, one of the misconceptions with HMOs versus PPOs is I won't be able to see my doctor, and that's not always the case. A lot of times you never realize a lot of these plans want to have as many doctors in the network, and sometimes what our members don't realize is when those doctors are in the network, there's usually a reason, and sometimes it's to protect you at the end of the day. And not every doctor needs to be in network, but the majority of them are, especially with us. And I think that's a great thing. Freedom to choose is always a big deal when it comes to Medicare, for sure.
Right. So to kind of tout our horn a little bit. So on the Blue Advantage, our statewide network has over 12,000 providers and over 100 hospitals. So that you would get with our HMO products. And then with the PPO, you have access to our nationwide Blue Cross network. So we're proud of our relationship with our doctors and really, understand the importance of that. So yeah, definitely understanding the doctors and, kind of knowing what you have access to is important. And definitely if you're in any kind of being treated or what have you, you don't want any disruption. If you're moving from your commercial plan with your employer, now you're moving to Medicare, you want to make sure there's least disruption with your health care as possible. So that's really important.
I think another thing that we need to make sure we communicate with everybody is how fast and how much we're growing. I mean, this year we've gone from 3.5 stars to 4.5 stars. I know that's a big thing that everybody needs to know. I mean,
Yeah.
4.5 stars, I mean, that's only going to make our plan so much better. So,
Right. Right. I
mhm,
mean, at Blue Cross, we're committed to Medicare. We're in the
mhm,
Medicare space. We offer Medicare Supplement. We offer Medicare Advantage. So, and obviously, you know us. We've been around knocking on 90 years in this
mhm.
state. So we're committed to Louisiana, and we're committed to the Medicare space.
And I like the fact that we are Louisiana based, Louisiana owned. So, that's going to make it, especially for the customer service side of it,
Yeah.
that makes a big deal. Being able to call and know you're talking to somebody who understands where your doctors are, understand the problems that you're dealing with. That homegrown feel is a big deal,
Yeah.
especially for the Medicare age people, because a
Right.
lot of times, with the scammers and everything, it just makes them so weary. So being able to talk to somebody in Louisiana, I know that's big for me.
Yeah, definitely. If our customer service for the Blue Advantage product is located in Louisiana.
Hmm.
So you're going to be talking to someone who lives here. They know we live in parishes, not counties. They probably can pronounce your last name if you have maybe a French sounding last name or
There you
some
go.
other type of name. So yeah, we are proud of that. We're proud of
Mhm.
our commitment to the state and to the residents of Louisiana. All right. Any more questions or anything we want to bring up? Yes.
If I'm 70, but I haven't gotten my Medicare yet, can I still do that?
So are they been working? Do they have credible coverage? What would you do as someone who's, kind of past the 65 age? What kind of guidance would you give them?
I think what I would tell them, one, if they're 70, that means that they've probably been still working. So 9 times out of 10, with that kind of situation, they're probably going to have credible coverage through their employer. And they just chose to work a little bit longer. A lot of times nowadays, that's the thing. Now, 65 is not the retirement age anymore. A lot of times you want to work through that. So you don't have to get on your Medicare right when you turn 65. As long as you have credible coverage, you're not going to be penalized. The big thing you're going to need to decide is when you're ready to retire, because once you become ready to retire, you're going to get a special election period for being new to Medicare. Because once you activate your Part B, then you can kind of go out and shop and everything. And of course, get your Part D as well. You can get Medicare Advantage. You can stay on traditional Medicare, or you can get a Medicare supplement, but there's no rush to get it done because you're going to be awarded your Part A whenever you turn 65.
So let's talk. So Medicare Advantage,
Mhm.
potentially, depending on what plan you pick, you have, it combines the Part A, the Part B, the Part C, the Part D, meaning your prescription drugs, your hospitals, your doctors, you may get dental, you may get vision. So it's kind of all bound in one plan.
Mhm.
But if someone chooses original Medicare with Medicare Supplement, talk through what other things they may want to add on to that.
Okay, so with original Medicare, of course, that you're just going to have your A and B, and then after that, with the Medicare supplement, that's going to come in and pick up where your original Medicare doesn't pay. So that's going to pick up your 20%. After that, you're going to have to get a standalone drug plan, and then from there, you're going to, if you want vision, you're going to have to buy vision standalone, dental standalone, and any other extras that you want to have. But the main thing about the Medicare supplement is just to pick up where your original Medicare doesn't pay.
Yeah. So I know a lot of people like the convenience of Medicare Advantage because you can get a lot in one location. It's one member ID card. I don't have to keep up with all these the other things. So I do know that's a big benefit of the Medicare Advantage.
Convenience is key.
Yeah. So remember, put questions in the chat. We can answer them now, or once our chat is over, we can do that. So this is an ongoing series called Medicare Made Easy. We do it as a Facebook Live. There's other series that we do. So if you want to go on the Blue Cross YouTube channel, you can look at in our old sessions. You can subscribe. So this is an ongoing series. So we want to help you, give you the content you need, answer questions. We have the Medicare content. There's ongoing health content. So that could be helpful to you. So don't forget to do that. Also, when these Facebook Lives come out and they're posted on the page, you can choose going. You can kind of plan to come in advance. So we want to make sure you know that there's this ongoing content here. Also, we have numbers to call for us. If you want to give us a ring, or earlier we put up, so there's a toll-free number for you to call. Earlier, we put up specific agent names and phone numbers to call them directly. If you call this number, you'll kind of route through and can get, get in touch with an agent. Also, you can ask for, if you go to this URL, you can get more information. You can ask for things to be mailed to you and kind of get more information. So we're here to answer your questions, get you more Medicare content, and so you feel comfortable when it's time to make your Medicare decision. And right now it is open enrollment. So they have until December 7th. So it seems like a long time away, but
it really isn't. It's
going to sneak up on us.
It is. It very much is.
Yeah.
Okay. Well, Tress, it was definitely.
No, it's good for us to talk here. So anything else we want to tell them? Because I know time is of the essence.
If nothing else, still make the call. Definitely sit down, even if you're going to stay where you are. Make sure you contact somebody about, the benefit changes, because they're always going to change every January 1st. So still, if you're unsure about something, give us a call. We'll be more than happy to answer any question, even if it's just general Medicare questions or something that you're just not familiar with. Give us a call anytime. Phone lines are open from 8 a.m. to 8 p.m. Monday to 7 days a week, actually, from October to March, actually. So anytime, anything you have, please give us a call.
So I do want to say, we've had our current members, what they do is call their agent. So like you're an agent and there's members, and at this time of year, they may have questions about what's going on and the changes and the updates. And so many of our agents have been fielding those questions and making sure they feel comfortable about the changes, the good news. There's been, positive updates and, just to make sure you understand, as we said, as you get older, and that, that your plan still fits your needs and is getting your healthcare, get you the healthcare you need. So, all right. Well, we're going to be wrapping this up. So any other questions, let us know. We'll answer them in the chat.
All right.
Okay. Thanks so much.
Pleasure seeing y'all. Y'all have a good day.